Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today, a Triad production. I'm your host, Dr. Graham Taylor. Today's podcast is part of our Clinicians series, where we take you into the therapy room itself, allowing you to hear and to learn what occurs between therapists and patients. As a clinician myself, I love these podcasts because they allow folks to appreciate the dynamics that take place in the therapeutic interactions, the words and the feelings that can get exchanged, and the process of change that can be transformative. Our returning guest today for this Clinicians series is Dr. Kathy Shear. Kathy is the founder and director of the Center for Prolonged Grief. She's been studying and treating people with prolonged grief for more than 25 years. Kathy engages deeply in research and teaching, writing, and recently her research contributed to the inclusion of prolonged grief in the forthcoming DSM-V TR to be released in March 2022. In her work, Kathy developed and tested prolonged grief disorder therapy, a short-term, strength-based intervention that helps foster adaptation to loss, which will be the focus of our show today. Kathy, welcome back. It's so nice to have you here.
Thanks so much. It's a pleasure to be here.
It's nice to have you back. I so enjoyed our first show where you were setting kind of a framework for us of understanding grief in a new way, with a new definition, going from complicated to maybe a better and more clarifying understanding of prolonged. And I want to get into that as a start. I want to come back to and get into really the nuts and bolts of your prolonged grief disorder therapy. That's really the focus of our time today, as I mentioned. Sure. But I want, if you could first, to give us kind of a 2-minute explanation, differentiating grief that was previously referred to as complicated grief, now being called prolonged grief, and why it's important to have this more clearly distinguished for those going through, and maybe even for those treating, a protracted bereavement process.
So there are really two main things that are very important about this. The first one is simply the simple fact that everyone will use the exact same name for the same thing. So we have been up until now using different names for the same thing and the same name for different things, and that's very confusing. So now we all mean prolonged grief. And the other important thing is that prolonged grief now has a very specific set of diagnostic criteria that are now officially in the DSM-5. Actually, they'll be printed in the DSM-5 TR, but they're in the DSM-5 as of now, actually. Okay. They are official criteria. And they include persistent, pervasive yearning, longing, or preoccupation with the person who died, and then at least 3 of 8 other symptoms. And this was very, very carefully researched and discussed and then tested. And so in these criteria, I can tell you, work for the majority of people that we've seen in our treatment studies. Not 100%, but almost all of them. So in that sense, it's really the same as what we have been calling complicated grief, but not everyone calls complicated grief the same thing.
You cited some of the signs and symptoms, and I want to talk a little bit about that piece. You know, in our last show, you shared that the emergence of grief is a natural occurrence to the loss of a loved one. And that grief, and I love this, that grief is the form that love takes when we lose someone. But for those with prolonged grief disorder, the meaning of the loss goes much deeper for that person. And I want to talk about that in just a moment, a little bit more deeply. But in terms of its impact, it can include a disruption in one's identity, a marked disbelief about the death itself, and avoidance of any reminders of the person, having passed, or avoidance of emotional pain. Help us understand a few more of those signs and symptoms that help rule in this diagnosis, and help us understand what's going on for the person experiencing this level of grief, and what may be going on for them that's got them experiencing it so deeply.
So basically, the other symptoms include other forms of intense emotional pain like sadness, guilt, anger, any real intense emotions, a difficulty moving forward in their own life, engaging in things that matter to them or with other people. And along with that, often a sense of emotional numbness, and often a feeling as a consequence that life has become meaningless
Yeah.
and an associated intense loneliness. And people have at least three of those in a very persistent, pervasive kind of way for at least a month, but it's usually almost always for virtually the entire period that they weren't totally numb
Okay.
since the death. So these are very common kinds of symptoms that go along with that intense yearning and longing and preoccupation with the person. It's like the person who died still completely fills the mind of the bereaved person.
I appreciate you laying those out. That allows us to say, hey, when is what we might call kind of a normal grieving move into a prolonged grieving where we're kind of stuck? And, it seems that we previously labeled what we're referring to now prolonged grief, but what we call the complicated grief as being maladaptive or dysfunctional. But what you're identifying here, and I think importantly reframing for us, is that prolonged experiences that one's encountering in their grief are just a natural part of the grief process for some. And you nicely name these in the literature that I've read as stuck points. And what happens with these stuck points is that they unintentionally derail the process of one adapting to this loss. Share more with us about these stuck points and the importance of seeing them this way.
Right. So the loss of someone close is such an overwhelming psychological event that we really can't wrap our mind around it right in the beginning. And it is associated with such intense emotions and powerful thoughts that take us away from our everyday life. That all happens naturally. And that is what's continuing to happen with prolonged grief. So it's not very different. It's the persistence of this. And so you have to ask, why does it persist? And the reason why we believe that it persists, and there's good evidence to support this, is that some of the ways that we initially respond that we need to kind of relinquish over time don't get relinquished. And what are those? So the first one of those that happens to virtually everyone is a sense of disbelief. I mean, someone who we love, who's been with us for whatever period of time, and now suddenly isn't there. It's unbelievable. It's literally unbelievable. We can't wrap our mind around it. So that takes a while. But over time, we do usually
Right.
find a way to accept it. And we also protest. We say no. Everyone says no. And then we start thinking all kinds of alternative scenarios, counterfactual thinking, we call that. But alternative scenarios of different ways that this could have happened so the person didn't die or didn't die in this way. And in addition to having a strong need for the people that we love, for them to kind of take care of us or be there for us, we also feel a very strong impulse to be there for them. And when they die, it feels like we failed them. Whether we have had anything to do with the death or not, we feel like we failed them. So we often have a sense of guilt, or sometimes we feel like we failed them because someone else didn't do the right thing, so they were angry about that. And then we want to avoid the intensity of the experience we're having, so we engage in a lot of different kinds of avoidance. Some of it is avoidance of reminders that they're gone, and some of it is avoidance of doing the things that we used to do with them. And then others is avoiding changing anything we used to do. So it sort of goes both ways. So these are the kinds of things. We have survivor guilt. A lot of that's a very natural response, but it kind of holds us back from moving forward in our own lives, as does a kind of a separation dread or separation anxiety, a feeling of not wanting to move forward in our own lives because of without that person it seems so empty, or it seems like we can't really manage without them. And then all of this, it kind of conspires to keep us away from our lives now. So that means keeping us away from ourselves and what we really care about. It means keeping us away from our past. It means keeping us away from our future and from other people, importantly from other people who also can have a hard time with us. So there's all of this is what conspires actually to keep us from moving forward in our life or adapting to the loss, from what we talked about before, when accepting the reality and restoring our own capacity for well-being and thriving.
It's hard because the path to accepting the reality and then, like you're saying, moving forward with our potentials and life going on requires us to go through a process. There's, that old saying, when one door closes, another door opens.
Mm-hmm.
But that's not quite right. The saying really is, when one door closes, another door opens, but there's hell in the hallway.
Mm.
And I think oftentimes what we're talking about here is that hell in the hallway is the things that I do to protect myself, some of these stuck points that are actually maybe my best ability to tolerate something that is just so overwhelming that
You get stuck. You got emotional. Is that what happened? Yeah. I mean, honestly, Graham, it happens to me as well. I totally get it. It happens to everyone in a way, but I think, acknowledging this is something that is maybe a good idea, an especially good idea in this context, because it's one of the things that holds therapists back, actually, from working with grieving people.
yeah, I appreciate that. Um,
And we can't be afraid to experience our emotions in a grief
yeah,
context. Really, we can't, because, I can't tell you the number of people who've come to me saying, it's such a relief to talk to you because I can talk to you. I'm always having to feel afraid of upsetting a
yeah,
therapist. And so, and the therapist, actually, they will redirect people because of that, because we are all uncomfortable with it. And it's not that I'm confident that I'm never going to feel upset. It's that I've come to terms with it. I kind of had to do this work,
sure.
really.
Yeah, I
So,
lost my dad
mm,
2 months ago,
oh my gosh.
and
Oh, Graham.
it was a really, he was 91, and it was a good ending,
Hmm. Yeah.
the best possible ending, I think. You could have, even though it was a 7-day period. It was a wonderful 7-day period,
Hmm.
and I think what we had a chance to do that was so helpful was to process it in process, to talk about it, to, as a family and friends, be with it and lean into it with him, help usher him into a good ending, and help usher us into that loss coming up. It was very meaningful. So as we're talking about, this lost piece, you're right. You don't uh, anticipate fully what it's going to mean to you until you're there,
Hmm.
and you can't. And then you're, sitting with it, and ideally, not sitting alone, which is what you're encouraging, not to sit with these alone, but to find a way to bring these experiences to a conversation level, with a therapist or with some friends, to see if these things can be moved through so they don't kind of reach those stuck points. So this loss for me is still pretty fresh, but so meaningful. So those going through a loss process, it's just a lot to contain. And while it's normal and it's an expression of the love that we had for the person, it is a heavy burden at times. And it's a lot to carry. And sometimes we don't know how to sort through it. In fact, I was thinking, folks that we're talking about that want to try and, avoid any reminders of the loss, or there's still this disbelief that the death actually happened, or the avoidance of any loss related emotions. How do folks with all of these, tendencies and behaviors, how do they find themselves coming into treatment with you?
So I would say there in two ways. One is early on. So there are a group of people who early on will seek help for grief because it's so unfamiliar to them. The feelings are so, they catch them off guard, and they in the middle of doing something else, and it's very disconcerting, and they think maybe there's something wrong. And so they come and they say, how am I supposed to grieve? Am I grieving right?
Yes.
Basically, they want to know that they're grieving right. So they basically need a kind of a check-in. And what I usually do, of course, is just kind of walk them through this way of understanding grief that we've already talked about,
Good.
which is often, really helpful to them, and make the point that this is a unique journey for every individual who starts it and every individual who loses someone, and so there's no way to tell them how to do it, but just these general principles. So that's
Yeah.
one way they come. And the other way, interestingly, for people with prolonged grief, they usually come because someone else
Mm.
has push them to do that. They usually come because they don't know what else to do, and people around them are saying, you've got to do something. And they kind of feel that way themselves, but they don't come expecting anything,
Yeah.
actually. So it's either someone else is pushing them, or
Right.
they're feeling badly about someone else that they want to be able to take care of. They have another child, if maybe a child has died or someone has died and they have a child to take care of, or someone that they really care about, and they feel like they're letting that person down.
Really good.
Yeah.
So someone comes in, they're finally kind of at your door, at your center for prolonged grief and coming into the work with you. Walk us through what you're doing in terms of welcoming them in, any assessments you folks do, how you're directing them to understand and kind of share this process. Walk us through it.
So again, we welcome them and thank them for coming, and tell them that we think that they made a really good decision to do so. And then very often what happens is they say, well, this is not me. I'm not me. I'm not myself. And
Right.
I'm feeling so out of control, and I'm sorry that I'm so emotional. And then we say, well, there's nothing to apologize for. And of course you're feeling a lot of pain. This is the most painful thing that any human
Mm.
can experience. Normalizing it, and helping them feel comfortable talking about it, basically. Talking about themselves also. And I always start, people vary with respect to this, but I personally always start by talking about the person, sort of saying, I know this is the most important thing in your life, but I want to get to know you a little bit first, and go into really a more or less standard kind of assessment that
Okay.
I would do for anybody who came to see me. However, I do pay special attention when I'm working with grief to include in my discussion with the person a discussion of their relationships, their early childhood relationships, and important relationships, not in a lot of depth, but sort of, who is it that's been there for you
Got it.
when things have not been going so well, and who is it that encourages you to do things and grow and learn in your life. That those basic questions, those are attachment theory questions, and
Nice.
they really are very informative. So I always include those. I always also include some exploration of things that they care about, their interests and their values in life, and also their accomplishments and their achievements, what they're proud of. And of course, who else is in their life now? And
Mm.
and so we have a kind of an outline of the kinds of things that we like to make sure that we cover in an assessment of grief. That's the basics.
We'll be right back after word from our sponsor.
Continuing education is both a requirement and a learning opportunity, but finding the right CE provider can be challenging. AATBS, a triad company, offers continuing education for psychologists, social workers, marriage and family therapists, counselors, and behavior analysts. CE courses are available both individually and as part of our new All Access Pass. All Access Pass provides a library of over 250 unique courses. That's more than 800 hours of CEs, with new courses being added every month. As a special offer, Behavioral Health Today listeners can save 15% on CE purchases. Visit us at aatbs.com/BHT and enter promo code BHT15 during checkout. That's aatbs.com/BHT. Check out our library and check off your CE requirements today.
What you're talking about right there, I know that your approach here is what you've referred to as a short-term strength-based approach.
Right.
And it sounds like starting out with getting to know the person it sounds like it's kind of reminding them of the resources they've developed in their life, maybe some of the attachments that they have, the things they've accomplished, things they're proud of, to kind of broaden a perspective within the context of this loss.
Exactly, Graham. That's so well put. That's exactly what we're doing.
Yeah, I love that, kind of that reminder piece. So folks are coming in, you're talking in this ways. How do you begin to kind of usher them into and kind of shepherd them into maybe kind of directing some conversation around and exploring who the person was, what the loss means. Talk about that next set of steps.
So that's exactly what we do. So we talk about their life for a period of time, and at some point when we've gotten a pretty good idea of the person, we ask them for permission really to shift gears and talk about the person who died. Tell me a little about them. So that's the entrance, is to talk about them. And by the way, someone with prolonged grief almost always really likes to talk about the person who died. They don't like to talk about their death, but they
Right.
do like to talk about the person who died. And for the most part, when someone has gotten to that point of prolonged grief, other people in their life are shutting them down when
Mm,
they just try to say that, whenever they try to remember the person will say, listen, I know this person was important to you, but you've got to start paying attention
yeah,
to other things too. And that's very painful.
that's
So when you
unfortunate.
ask them to talk about the person, that's very, very helpful to them also.
When you put it like that, what I really love is that, here's somebody who's just really stuck in this grief in a prolonged way. But the person they lost is someone that they really loved, likely they're proud of. This is
Exactly.
somebody who meant something. And you're saying, hey, let's lean into that.
Yeah, exactly.
How does that go?
So that usually goes well. And if anything, you kind of have to, again, you have to make some kind of comment about, whatever you've been hearing. You want to be actively listening. And so you're going to interact with the person, validate, support, whatever. But at some point you're also going to be a guide. So you're going to again say, I would really like to spend a lot more time talking with you about this person, something like that, whatever really fits in the time. But I do want to hear a bit about what happened. So what happened? What
Right.
happened to them? How did they die? What happened to them? Something like that. When you've moved into it in this way, the person is usually ready to tell you something about it. They won't tell you necessarily all the details. They won't
Mm,
love to talk about it. They might get very, very emotional talking
mm,
about it. That's would be expected. Whatever. We want them to do that. Again, are going to validate, support, empathize, whatever. And then you're going to say, well, now let's talk a little about how things have been for you
mm.
since this death, which might be decades. I mean, sometimes it
Yes.
is, but
Yeah.
it's at least a year, right? So, what have things been like for you?
I'd like to hear, and I'm going to ask you about just the stuck points in just a moment
Yeah.
as and how you help people identify them. But what I love that you're saying there is you're encouraging them to say, hey, can you tell me about how the person passed or what the process was that they went through or the loss?
Hmm.
It's in those moments where someone's been so afraid to talk about those things.
Hmm.
And it's almost like you're kind of emotionally spotting them. They're lifting something very heavy and
Hmm.
something very
Yeah.
challenging, and they don't think they can do it themselves. But when you come alongside them in that way and kind of emotionally spot them, it's almost like they're able to talk about it in a new way and kind of take in and hold that through conversing about it with your support and be able to hold that and journey with that in a different way, can't they?
Graham, I love the way you put things. I think, would you like to come and work at the center with us?
You're very kind.
So yeah, that's exactly what we're doing. And then we're going to move into first we're just going to listen. We do a lot of active listening in this therapy from an overall framework. And so we're just going to listen to how they present their lives moving forward. But what we're going to be listening for is that process of adapting and what's maybe standing in the way. What are some of the stuck points that you mentioned that are maybe standing in the way? And again, we're not going to lean on those very much at all in this is our first session with someone, and we're really just interested in hearing their experience, basically. That's primarily what we're doing, but we're listening with our therapist ear to where there might be a little bit of stuckness. Because, the other thing I should mention about people who have experienced a major attachment loss, another very natural thing is that we are not the most open that we are in our lives to other people, right? It kind of like we feel a little bit like gun shy or burned,
Mhm.
Uh,
Yes.
so we don't really, we're a little bit in a place that you might think of as attachment avoidant, which is to say that we're kind of feeling like we have to rely on ourselves. We're a little bit suspicious of other people's being able to understand us. People don't feel like they don't expect us to understand. And in some way, we can't understand each other fully in this particular space because it is very unique. In other words, we don't want to be too quick to try to work with the person. We have to develop a relationship with them before we start to really work with them, even though we're working in a relatively short-term way with, with 4 months. I mean, these days
Yes.
that's not short term, but
Right. So in essence, you're coming alongside them. You're just kind of gently nudging, but
Mhm.
you're letting them kind of determine the course that they need to go with some guiding questions or some nudging that allows them to open up more and more.
Yeah, but I'm not even sure we're nudging. I mean, I think we're just
Okay.
listening at this point. We're listening.
Got it.
We're kind of trying to open up possibilities for them to tell us what they're experiencing right now. The next session, so I'm talking about session 1 right now. Session
Okay.
2, we're going to do a lot of psychoeducation, a lot of what, again, we did last time about what is grief
Yeah.
and where does it come from and how does it relate to love and all that. And then what is prolonged grief in
Okay.
the way that we just described it. And as we do that, then we're going to go back and either say, you mentioned the fact that it's been 3 years and you still can't believe that this happened. Well, that is a very natural thing, but that's one of those things that's going to get you a little stuck, naturally get you a little stuck. Or, of course, I wouldn't, you mentioned you would never ever go to the grocery store that you shopped in for this person. And I can understand that. But that's the kind of thing that people will avoid, but you probably over the long run, you're not going to want to always forever avoid that. But you're going to start to pull in
Mm.
those what we call stuck points or derailers or whatever you
Yeah.
want to think of them as examples. Maybe with a suggestion, this is session 2 now, when
Yeah.
we're talking about psychoeducation. And then we're going to move into here's the plan for the next 16 weeks now that we're here. We're back and forthing and we're listening and we're asking, answering any questions. And then we're going to say, okay, so would you like me to lay it all out for you? This is the plan. And here's how we're going to move through the sessions, and here are the kinds of things that I'm going to ask you to do in between our sessions. And in that sense, this is kind of CBT like. I mean, there are a lot of elements of what we call prolonged grief disorder therapy, or PGDT now,
Yes. Uh-huh.
that are very CBT like, but there also are components of interpersonal psychotherapy. There are components of actually motivational interviewing. There are a lot of components of motivational interviewing. There are components even of psychodynamic psychotherapy.
Hmm.
So there are strategies and sort of ways of working that come from different therapy models, but they're
Really.
all organized around the framework of the way we understand grief and loss.
So someone gets to come in and over the course of time, they're seeing that, hey, it's feeling safer and more trusted that I can begin to lean into and talk about some of these things with you. And yet I get stuck on something. I don't maybe want to go to the same grocery store that we would go to every Friday evening together after work, or I don't want to go to that movie theater anymore, or I can't go into that room because it's just too triggering for me.
Yeah.
How are you helping folks through those types of avoidant behaviors?
So we're going to be doing a set of 7 very specific procedures, and they're going to be helping with 7 actual, what we sometimes call healing milestones, or we call themes of this 16-week treatment. And one thing I didn't mention that we end session 1 with is introducing a grief monitoring
Mm.
procedure, which entails, it's very simple because, again, we have to honor the fact that people who are grieving intensely don't have much extra time in their lives or much extra energy to do anything. So we try to keep what we ask them to do, especially early on, kind of minimalistic, but we also want them to start working with us. So what we do is we introduce grief monitoring, and we do it in the following way. We ask people to take just 5 minutes, literally 5 minutes at the end of each day, look back over the day and try to think about their grief experience, the intensity of their grief, which is usually the emotional intensity, really, but the intensity of their grief back over the course of the day, and what was a time when it was the highest. So it might have been high much of the day, but to try to identify, if they can, a time when it kind of spiked up a little bit, and write down a number from 1 to 10, and then a very brief comment about what happened, what was happening at that time. A common time would be waking up in the morning. You wake up in the morning when you have prolonged grief, and at first you feel fine, and then all of a sudden
Right.
the memory comes back, and so then the grief intensity will spike up, and you just say woke up in the morning. That's all you wrote, and then you look back over for a time when the grief was at its lowest and do the same thing, what was happening at the time. And then you kind of take a big picture, overview of the whole day and just say, was it a high, medium, or low day?
Got
Low
it.
grief day. And you can put a number on that or just say high, medium, or low. You do that every day. And then when the person comes in that second session, we're going to spend a little bit of time just looking at that log that they've kept, because we've asked them to do that, to write it down, and then just noticing how often they've done it. So some people do it every single day, some people do it once, and they do it every time in between. And we basically are very supportive of whatever they've done, and then we talk about it a little bit, which I don't want to get into too many of the details because
Uh-huh.
we won't get through this, but
Sure.
that's basically what we do. And we're going to do that every single session throughout the whole. So that's the grief monitoring. And what we're looking for there is helping people understand and accept grief. So that's the first of these themes, and that's going to run through the whole treatment. We're going to be always looking for ways that people are not accepting their grief, because
Mm.
sometimes that's a problem. And also, we're going to start to build in ways to manage those really painful emotions, because that's sometimes what is problematic about the grief. So that's the second of these themes, is managing emotional pain.
Yes.
Then session 3, we're going to actually encourage this person to bring someone in to that. So we're going to have a visitor in session 3. So that's another thing that we're doing as we're starting to build this therapy, because one of the big important things that we need to do is to help people strengthen their natural relationships. And almost everyone with prolonged grief disorder actually has people in
Yeah.
their life. And I mean, there
Yeah.
are exceptions, but almost everyone has someone that really cares about them. And
Yes.
those people are almost always feeling very frustrated, and they don't know what to do anymore. And they often have either withdrawn or become kind of harsh.
But they're just left feeling helpless ultimately of how do I help? So you're helping kind of maybe reconnect them
Exactly.
in ways that can be helpful.
The end of session 2, after the psychoeducation, most of it is psychoeducation, we actually bring in what we call aspirational goals work, which it's actually a takeoff on motivational interviewing, personal goals work. But we call it aspirational goals because we want it to be a long-term life goal that extends well beyond the therapy itself. So basically what we do at the end of that session, right before the end of that session, is we ask people if we can shift gears again. We get permission to do that. And then we say that if we could wave a magic wand and their grief was at a manageable level, what would they want for themselves? And
Yeah.
often we have to add that we know that their grief is not at a manageable level, and that's why they're here. And we're not trying to say that we can do that, but we want
Yes.
them, it's an imaginary exercise.
We have to have a vision, don't we? Even if we don't think it's possible, if we can just cast one with them in that process, it's something to kind of hold up. I think it's a very important piece. It holds some hope, even if in the moment they just feel so entrenched and encompassed by whatever. So, they're part of the grieving, but to have that cast, I think, is an important piece.
Right. And it's, again, it's kind of like what you said before. It's a way of me saying to the person, I know that you care about things, and I know
Yes.
you have values, even if you have no idea what they are right now, because that's the usual answer. Because what's amazing is that people in the second session of this therapy, when they're really, really basically being flooded with grief, sometimes people do answer, that question,
Mm,
but most of the time they don't. Most of the time they say, I have no idea. I
yeah.
don't think I care about anything anymore, things like that. But I've still said it, and I don't give up either after
Mhm.
that. When they say that, okay, I understand completely, but is it okay if I ask you this again as we move forward? Or would you be willing to just try for a couple of minutes a day
Yeah.
during the next week to just try to think about something that you might possibly have cared about before, that you might care about going, whatever I can get them to do, the smallest little thing. I try to keep going with this. And this is another thing I'm going to keep going with throughout the whole therapy. And I will say that I've worked with people very successfully who never answered that question, but
Mm,
we still talked about it each
yeah.
time.
I think,
And yeah,
yeah, I see that as an important thing because with the grief, life, almost like with blinders, can become very narrow. And it sounds like what you're gently doing there is kind of trying to kind of nudge open just a wee bit or help them just begin to think, what might it be like if some of the blinders might be opened back up, and what might life possibly have in it that we could bring it back? And just to name that, I think is a cool thing. I know I just sensitive to our time and I wish we could just keep talking, but I want to get to something that's pretty exciting, this online tutorial. But before we do, may I ask, as folks are going through this therapy with you and in this 16 weeks and the strength-based, the short-term work that you're laying out for us in terms of the steps, what are some of the results that you're seeing in people's lives? What are they walking out with?
for the most part, they would say
Okay.
completely changed, that they feel, even when they don't have 100%, and no one does, by the way. I mean, grief is a long-term
It's
pro
permanent, like you said before.
it's permanent, and it takes time to
Yeah.
unravel all of this. So we're not looking for that, but people will say they feel just very differently about themselves and about the person who died. And it's not that they've put them behind them, it's just that they feel a
Right.
different kind of sense of connection to that person,
Yeah.
a much more positive connection, one that can be enriching of their lives. And it's always sad. There's always going to be some sadness in it. There's
Sure.
always going to be some of those emotions. And in terms of our research, we have done 3 major
I
studies
know.
of this therapy, and the results were pretty amazing. And we always compared prolonged grief disorder therapy to a proven treatment for depression, a really good treatment for depression, because that's what is usually kind of confused with grief. And often people have both, they do have grief and depression. But what we found is that the depression treatments will help the depression component, but they don't help the grief.
Got it.
But the grief symptoms, we had an overall 70% response rate
Yeah.
to this treatment compared to a 30% response rate to very good to interpersonal psychotherapy for depression, which is, has a grief focus, and it's a
Yes.
very good treatment for depression. I think they're starting to modify it now, and it's possible that you can modify IPT enough so that it looks enough like
Yes.
this treatment, and that's great. I mean, I think people should do the kinds of treatments that they're most comfortable with and that they like to do in terms of therapists. But you do need to have these different components. I think you do need to focus on people's being able to adapt to a
Yes.
loss in these important ways, and also do something to help the stuck points.
Speaking of the treatment approaches as you have today, you shared with us offline before we came on today this new online tutorial
Right.
that can help folks learn about this treatment. This can be both for therapists and for those going through a grief process. Give us just kind of the skinny on that, would you?
Sure. So this is an online tutorial, it's called, that was developed by the Center for Telepsychology in Wisconsin, that's headed up by my colleague Kenneth Kobach, who's a psychologist who has been developing these tutorials for a number of years now, and he's really, really good at it. And the two of us work together to produce a
Nice.
10 module tutorial that it takes about a half an hour to go through each of those modules. I would think that people probably will kind of go back over them, but it's very, very interactive. It includes some video material and some animations and all kinds of things like that. It's really pretty interesting.
Congratulations. That's terrific.
Yeah. So and then there's a kind of mirror one, a parallel one for the bereaved people going through this with the therapist. We don't actually encourage them to do it alone, in part because of what we were talking about earlier. It's so much more meaningful to have someone by your side who understands what you're experiencing. And so
to help witness, that process. I think that's a very healing component to this.
yeah.
In addition to that tutorial, and as we begin to kind of circle back to kind of a closing for today, what are some resources that you might give our listeners regarding complicated grief therapy, and also resources for the Center for Prolonged Grief?
Right. So we do have a lot of resources at our center, and that's really basically the best place to then go out from there as well. But that's the Center for Prolonged Grief at Columbia School of Social Work. Now we changed it from complicated grief. You can get there either way, actually. But we have on that site, we have a series of 10 videos also of a therapy that I did with someone who came and agreed to be videotaped for training purposes, and then wanted that disseminated more so. So we have those training tapes available. We also have a manual. We have regular workshops that we offer 2 or 3 times a year. They're being held this year on both coasts. They were up until now, they've been on the East Coast, but now they're on both coasts. And we have a lot of different kinds of handouts and some rating scales that can help people, therapists who like to use rating scales and such. Yeah.
It really is a wonderful site. I mean, we're going to have this up on our webpage as well, where people can kind of go in. I know we've said that the landscape in our lives changes following a loss, but there's life, as you said in our first show, and you're saying again today, but there's life to be lived after the loss. And I know your model is uniquely helping folks grieve in a productive and in a growth-oriented way. And you're clearly holding up this belief that we can find a path after a loss that can allow us to continue to grow and have joy in our life while continuing to carry and relate to the one that we've lost in a very meaningful way. So this is some awesome work you're doing. Congrats with the DSM-V TR admission of the prolonged grief. That's a huge process, I know. Yeah. And I'm so thankful that you had a chance to be with us today. Thanks for being on our show.
Thanks so much, Graham. It's a pleasure.
It's great to have you.
Thanks for all you do.
Well, I also want to thank you, our listeners, for joining Kathy and me today. We always appreciate having you with us. And I want to remind you that this episode, with its resources and all of our other shows, can be found on our webpage at triadhq.com/BHT. So go check out our webpage, triadhq.com/BHT, and explore our archive of podcasts and resource materials. Thanks again for being with us, and we'll look forward to having you next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Tribe Network, all rights reserved.